choice questions focused on Borrelia burgdorferi, the spirochete that causes Lyme disease, transmitted by Ixodes ticks, which live on deer and mice. Each question has 5 answer choices, includes the correct treatment, and explains why the other options are incorrect. Question 1. Early localized Lyme disease. A 28-year-old hiker presents to the clinic in July with fatigue, low-grade fever, and a circular rash on his left thigh. He returned from a camping trip in Connecticut 1 week ago. Physical examination reveals a large erythematous ring with central clearing, target lesion. No joint pain, neurological symptoms, or cardiac abnormalities are noted. Which of the following is the most appropriate treatment? A. Doxycycline, B. Ceftriaxone, C. Amoxicillin clavulanate, D. Metronidazole, E. Azithromycin. Correct answer, A. Doxycycline. Explanation: the patient has early localized Lyme disease characterized by erythema migrans, target-like rash, mild systemic symptoms, fatigue, fever, recent tick exposure in an endemic area, Northeast USA. Doxycycline is first line for early localized Lyme disease in patients 8 years old and not pregnant. Why not the others? B. Ceftriaxone, used for late disseminated Lyme disease, e.g. meningitis, carditis, arthritis, not needed for early localized disease. C. Amoxicillin clavulanate, broader spectrum. Amoxicillin alone is used if doxycycline is contraindicated, e.g. pregnancy or child 8. D. Metronidazole, used for anaerobic and protozoal infections, no activity against Borrelia. E. Azithromycin, considered less effective, reserved for patients allergic to both doxycycline and beta-lactams. Question 2. Late disseminated Lyme disease, neurologic manifestation. A 16-year-old boy is brought to the clinic for facial droop. He also complains of headache and neck stiffness. 2 weeks ago, he had a fever and a red expanding rash on his chest after a camping trip in Pennsylvania. Neurological exam shows bilateral facial nerve palsy and photophobia. Lumbar puncture reveals a lymphocytic pleocytosis. What is the most appropriate treatment? A. Doxycycline, B. Acyclovir C, amoxicillin, D. Ceftriaxone, E. Prednisone. Correct answer, D. Ceftriaxone. Explanation: the patient has neuroborreliosis, late disseminated Lyme disease, with bilateral facial nerve palsy, classic in Lyme disease, lymphocytic meningitis pattern on CSF, history of erythema migrans, and tick exposure. Ceftriaxone IV is the treatment of choice for neurologic Lyme disease and Lyme carditis. Why not the others? A. Doxycycline, used for early or mild disseminated Lyme, but not sufficient for CNS involvement. B. Acyclovir, antiviral for HSV-VZV, not effective against Borrelia. C. Amoxicillin, used for early Lyme and children pregnancy, not used for neurologic involvement. E. Prednisone, corticosteroids may worsen infection if used without antimicrobials, not first line. Let me know if